Good morning and welcome to Motivation Monday. This is Trainer David coming at you from somewhere in the Pacific Northwest, still broadcasting from my basement. Anyway, welcome to Motivation Monday, and we'll just kind of get things rolling here. Let's see. Okay, here's our quote for today. The top salespeople are usually the ones with the most activity. It doesn't guarantee that you'll close more deals, but if you have no activity, you won't be closing any deals. I'm not sure who Colleen Holman was, but I thought that was a great quote. He said Motivation Monday. So what we have here for today will be starting off with our tip of the week. Some sales shout outs. We've had some people really putting up some nice numbers. And then we're going to look at the Medicare gathering sheet. Trainer Lisa went over just a gathering worksheet, but in the world of Medicare, there are a few additional things that we need to be looking at. And so it's a little bit different when it comes to Medicare as to the kind of information that we need to be gathering. So sort of keeping with the Medicare theme, our tip of the week here is that Aetna is looking at using CVS. Okay, remember CVS actually owns Aetna, but it's looking at using the pharmacies to collect premiums and payments for the Aetna plans. So they'd be able to pay by credit card. You would just bring your bill in. They would scan the little QRP on there and be able to pay the bill at a CVS pharmacy. So that would be great for those who are using any of the Aetna like drug plans or any of their indemnity plans. Dental plans, I mean, whatever from Aetna that they've purchased. So looking at some of the sales, here's what's kind of been selling. Okay, the NHIC, okay, that's been the kind of go-to short-term plan. And then for limited medical, it's been Golden Rule, again, United Healthcare. The accident, we're back over to NHIC, but for critical illness, Golden Rule kind of seems to have that as long, and dental. I was hoping that we'd start seeing a little more of the NHIC and dental, but not yet. Okay, I mean they've rolled out that new plan, and it's expanding in its states, but I think it only started off with 5 states, so it's probably going to take a little bit of time before we start seeing any numbers going up in there. So as far as who's doing the selling, seems like we see a lot of the same names a lot here. On the short-term side, it's been Max, Bill, and Robert. Okay. Those guys have been putting up some pretty good numbers for short-term medical. Limited medical, Katia and Arthur. And again, with the accident, Katia has been in there, and Tim Brown. I was kind of surprised because normally you see short-term medical and accident kind of going together, but it just didn't seem to be working out that way this week. And then when it comes to Medicare, I had some great numbers from Isaac Oken and Maureen McNally. Both of them put up some good numbers in the world of Medicare. Isaac in the Medicare Advantage plans, and Maureen in Medicare Supplement plans. So I just thought I'd give them a shout out also. Whoa. So there's what happens when you push the wrong button. So let's see if we can't get that back up over here. Okay, get us caught up again here. What a way to start Monday here, huh? Okay. Okay, so we're going to look at that information gathering worksheet, but this time it's going to be more emphasis on Medicare. There's just always, a few things that make that a little bit different. And for those that are selling Medicare, I think you'll find this will help out quite a bit. So I kind of start off with looking at, I got some minimum information I need literally for my management system. Okay, I need a name. A lot of this I'm going to need just to provide a quote anyway. Birth date and gender, a telephone number, and then a zip code. And if that zip code spans multiple counties, I'll need the county they're in, because in Medicare, it gets that specific right down to the county. I was using for a CRM required that I have all of those in order to create a record. So I don't know which ones you're using, but I did need to have that to create a record in the one that I had. Now these are just like to have. I don't need it right away yet at this time yet, but it's always kind of fits in here. Having an email, the physical address, mailing address if it's different from their physical address, whether or not they use tobacco, and an income or budget. Those I don't have to have, but they're nice to have. Okay. I always want to know that income or budget, because that's going to help right away between Medicare Advantage and Medicare Supplement. If they don't have any budget, then obviously I'm not selling them a supplement, right? Because those typically start, I mean, in around $100, depending on where you live. And their Medicare status. I mean, where are they in the process? And then because if it's going to be, an AHCP, in other words, when they first signed up, are we in that 3 months before, or the month of, or is it all gone away and we're not in there anymore and they haven't done anything? I mean, just where are they in the Medicare process? Okay. ESRD. Now that's going to have to still be in place for the rest of this year, although for our upcoming open enrollment for plans that are going to start in 2021, ESRD is kind of is going to be going away, because and for 2020, it's still a disqualifying factor for a Medicare Advantage plan. But starting in 2021, it will not be. Okay, CMS has changed that. Do they have a Medicare identification number? I mean, where are they, like I said, in the process? I mean, I got people that have called in that, I haven't even applied yet. What do I do? So I would, get them through that process also. But I just needed to know kind of what their Medicare status was. I'm 65, but I haven't signed up yet. Or, I'm getting ready to retire. Now what do I do? Or, yep, hey, looking to sign up for something. And then I want to know those Part A and Part B dates. And in significance is the Part B within 6 months, because that is going to determine whether or not they go into a Medicare supplement plan, whether they'll be underwriting or not, right? Because if it's within 6 months of their Part B, no medical underwriting. So those are just, some really good information there. The more the better. Remember that all these people have been taught to guard with their life their Medicare identification number and their Part A and Part B dates. So sometimes you have to work with them and build a little trust before they'll even provide that to you. It's a little bit easier than when it was Social Security number that went with that. It's still, you remember that they have been told to guard that and be very careful with it. So if you're doing it over the phone, it can be, you have to really establish a level of trust before they're going to provide that. As we go through this, I always tried to make it a conversation rather than an inquisition. Okay. In other words, I would try to engage in conversation and work these questions into it so that I could build that level of trust with the Medicare beneficiary. Now, outside of open enrollment, I'm looking for some kind of special enrollment, something that is going to let me enroll these people now. And these are kind of, what I'm doing. Is I'm really trying to dig for that special enrollment in there. And this is the kind of information that I want to know. I mean, are you on Medicaid? If you're on Medicaid, great. Go right to a Medi plan if there's any in the area. If not, it's still an SCP, and you can enroll them in a regular plan. Are they getting the low income subsidy? Again, that's that one, just like Medicaid, that gives you an SCP to make a change once a quarter. And then I always throw that income one in there because depending on that level of income, I may have to throw the extra step in of getting them enrolled in extra help. And that's okay because I own them for life if I've done that. Because what you'll find is that you've really taken that extra step, you've really established a good rapport with them. And as long as you maintain that contact and maintain that rapport, they're not gonna buy from somebody else. And so you really just wanna keep working that. So I would go for the income. Then the most common, I would say, SCP is going to be that they've moved. Okay, so that's always asking about that. So that's many times they don't know that moving is an SCP, and what happens is they find out that they're being canceled by their previous plan because they moved. So loss of coverage, typically, lost a job, retired, or something in there. Now, when I'm getting down into some of these here, I'm really reaching now because they're not, so I'm asking these questions. Any chronic conditions, because there may be a plan that I can put them in because it's one of the special needs plans, but it's the chronic one where if maybe they've got diabetes and there's a diabetes plan in their area. So you can always enroll them in that. I'll look for veteran status. Then it can help with things like drugs, and it can help establish rapport. I always ask that question. Some of the Medicare plans will ask that also. They just want to know. State pharmaceutical assistance, just like having extra help. If they have any of the state pharmaceutical assistance, they got an SCP there. 5-star plans. Okay. I usually keep a list of of the 5-star plans. The one that came up most often is in Florida, and it's one of the Humana plans down there. It's not Humana, but it's owned by Humana, and it's that I think it's called Care something or the other, but it shows up when you do a Humana quote. So if it's in the area. So remember, with the 5-star plan, you can do that enrollment once a year and into a 5-star plan if there's one in the area. There's, being really technical, there's about 1 week out of the year that you can't enroll. So it's really just one of those little things that was not intentional, I'm sure. If you read on the 5-star plan, it says that you can enroll anytime after from December 15th December 7th at the end of open enrollment through November 30th of the following year. So technically by that, you have that 1 week period in there that you couldn't use that SCP to enroll in a 5-star plan. You'd be an open enrollment and can do an open enrollment, but that's just one of those little quirky things that are in there. Now, here's where things really get different in Medicare versus a non-Medicare type plan. Because I need to know this information. I need to know who their primary care physician is. if they have any specialists, what they're seeing, how often are they seeing these, are they open for change? And that comes up a lot because maybe the doctor's not in the network, the one that the plan that looks like it would work best for them may not have their primary care physician in it. But I've come across this situation, and so I always ask if they're willing to change, and I've gotten answers like, well, my primary care physician is Dr. Smith, and I go look up, and Dr. Smith's not in the network. But with a few questions, you find out that it had been Dr. Jones for the last 35 years, and Dr. Jones just retired. I've now got Dr. Smith, but I've never seen them. Okay, so those are people are usually pretty open to change. The reason I want to know how often they're seeing that specialist is typically in many of the Medicare Advantage plans that can be a pricey visit, maybe $50 to go see a specialist, and if they're seeing it more often than maybe once a quarter or something like that, they're going to be looking at maybe throwing a hospital indemnity plan in there where it'll kick in the payment to see the specialist and get it covered. But I need to know those doctors because one of the biggest complaints in Medicare is that I was told that my doctor was in the network and it turned out that they weren't. So we want to really avoid that. And by looking up all the doctors, and it's not good enough to say I'm enrolling in an Aetna plan and my group plan that I'm in, that is an Aetna plan, and the doctor takes that, because it does not mean that they take the Medicare plan. And then in many cases, the network for the HMO, the doctor's not in there, but for the network for the PPO plan, the doctor is. And that's all with the same company. So we want to really be careful and look those up, okay? And see specifically, does the doctor take the plan that you're looking at enrolling them in? When it comes to prescriptions, we need to know generic and brand name. One of the areas that this can really become a problem when you get in there is dealing with people who are on Medicaid. First of all, they paid nothing for their prescriptions, and now they will, even if they still have Medicaid with their Medicare. Even though it's a pretty small contribution to the payment, they're going to be finding out now that what was free is no longer free. It may only be $1 or $2, but hey, you know how it is. If you have something for free and now it costs, they're usually pretty ticked off about it. Many times I've had people tell me, well, I only take the brand name. Well, okay, you can. We'll find out if that plan takes the brand name, and whether or not, and what that co-payment's going to be, even if you were on Medicaid versus the generic. And it can be a difference of, several dollars in what they would pay. And for somebody who's, making less than $1,000 a month, paying several dollars for a prescription that was once free can now be a big deal. So you're going to actually need to look up in whatever prescription plan that you're using, whether it's a standalone Part D or if it's a part of a Medicare Advantage plan. You need to look up each prescription and discuss what the payment is actually going to be for that particular prescription with the beneficiary. And these are just any of the special needs that you can address. Diabetics, here's the thing that you find a lot with in the area of diabetes is that two rather popular and probably most popular insulins, one is Humalog and one is Novolog. Virtually identical, but if you're taking, you need to make sure that back there under prescriptions that you kind of look at that. And some companies will all be Novolog and some companies will all be Humalog. Even though they're interchangeable, it's a change that the person has to make, and they're going to have to discuss that with their doctor before they can do it. So again, we know that they're interchangeable, but we're not doctors, and there could be a specific reason because they're not manufactured the same, or whatever it goes into. Vision could be a primary driver. This one really comes up a lot, is dentures. I need a dental plan that covers dentures. In the world of Medicare, the plan that comes with an Advantage plan probably does not cover dentures. But you can really dive into those, and that can be a controlling issue over what plan they want. Gym memberships. I've had people literally call in wanting the plan that covers silver sneakers, because that's the gym that they want to go to. That's where their friends are, and it's just that's, if it didn't have silver sneakers, they didn't want it. It had to have that particular program. Many times transportation is a driving factor. I need transportation that's going to take me to and from the doctor's appointments and to and from the pharmacy to fill my prescriptions. Some plans have those, some plans don't. Some plans have unlimited. Some plans will say 10 round trips per year. So that's really only 5 trips to the doctor or the pharmacy or whatever. The other big one that would come into play was hearing aids. They particularly want a plan with hearing aids. Not all plans cover them the same. Many of them will use discount plans where you'll actually go to whoever their discounted company is, and you're getting a discount on the cost of the hearing aids. And other plans will actually have a copay. It may be a fairly hefty copay. I've seen them as high as like a copay of $650, but that's for a $5,000 hearing aid. So even though it's a pretty hefty price, it is a phenomenal hearing aid that they're going to want. So these are kind of all the things that you'll want to be sure that you cover when we're dealing with Medicare. So you can see it's a little bit different than doing a family of 4 with nobody on Medicare, because the concerns are typically different. If anybody wants a copy of the actual worksheet, I do have it in Word, and I can email it out to you. Just send me an email at training@ahpcsales.com, and I'll get it on. I'll send it back to you.